SolveMyChallenge.com. Yeast infections are as annoying as they are common. About 75% of women will get at least one yeast infection in their lifetime, 45% will get more than one, and then some women suffer from chronic yeast infections. Yeast infections are caused by a fungus called candida albicans. Yeast is always present in the vagina, but an overgrowth of yeast is the problem. Yeast is generally a harmless fungus that is always found in the vagina, digestive tract, and mouth in small amounts, but when an imbalance occurs, the candida multiplies, which causes an overgrowth and results in a yeast infection. The symptoms of a yeast infection are vaginal itching, burning, discharge that is usually thick and white, painful urination, and pain during and after intercourse. There are many possible causes of yeast infections. Sometimes simply taking an antibiotic results in a yeast infection. In addition to destroying bacteria that cause illness, antibiotics kill off the good bacteria that normally live in the vagina. Without this necessary bacteria in the vagina, yeast cells can take over and grow out of control. Other possible causes are wearing tight clothing, particularly underwear, douching, using feminine sprays which causes moisture, uncontrolled diabetes, and pregnancy. Recurrent yeast infections or yeast infections that don't seem to go away even with the medicated treatments are usually a sign of a more serious underlying medical condition such as diabetes or a poor immune system. Sometimes women are first diagnosed with diabetes after seeing the doctor on the first onset of yeast infection symptoms. Pregnant women are especially prone to develop yeast infections because pregnancy changes the hormonal and chemical balance in the body. Yeast infections can be difficult to treat during pregnancy, and some pregnant women will experience recurrent yeast infections.